I had pain in both knees a lot, my left knee more than my right. It's been going on for probably about 8 years. I limited to when I tried to get up, it was total pain. I couldn't walk very far. I wouldn't go out to the mailbox anymore. Shopping was getting tough. I just couldn't do all my daily activities that I wanted to.
Okay. Had any other doctors told you need to get like a knee replacement
Definitely.
or anything else?
Yeah, both. I've had a few doctors telling me that I needed one. I was pretty much bone on bone and needed it.
Okay. So you decided not to do that, so you went through our stem cell therapy program.
Correct.
What has changed in your knees since going through that?
It's been totally amazing. I don't have pain anymore. I can walk however I want to. I walk out to the mailbox. I can do things. I feel like my mobility is back and I can walk well. I do have a little bit of stiffness in my knees, but I'm working on that, and I'm just very happy with no pain.
Great. So how much would you say you've improved 0 to 100%?
Really close to 100%, maybe 98 to 100%. I'm very, very happy. Would totally recommend it to anyone.
Excellent. Thank you.
Chronic pain in my wrist and my ankle.
How long had it been going on for?
2 to 3 years.
Okay. How bad was it?
On a scale of 1 to 10, I would have to say it was between an 8 and a 9.
Okay. And any activities you couldn't do with your wrist or your ankle because of the pain?
Golf, leisure walking, anything that involves those two things. It was causing more pain if I put stress on it.
Okay.
Swinging a golf club was extremely hard on it.
Okay. So you went through our regenerative medicine program. How much improvement did you have in your wrist and your ankle since going through that?
I would say that if I have any pain when I'm using it, long walks or playing golf, it's maybe a 1 or possibly a 2. But this experience has really taken it down significantly.
So it went from severe pain down to very mild pain?
Yeah, moderate. Yeah.
Okay.
Yeah.
How much do you feel like you've improved overall, like 0 to 100%?
Oh, I would say I'm probably 85% back. You know, I look forward to playing golf and going for walks now. So
excellent.
Yeah.
Was the procedure itself really easy?
Very much so.
Okay.
Very much so. It was all about a shot. That was it.
Okay.
So very educational. The seminar was worth it, big time.
Excellent.
So I would recommend anybody. I have been recommending a lot of people this experience. And
Perfect.
I think it's very new to the world. So
Thank you.
yeah, you bet. I enjoyed it. Thank you.
I've had knee pain ever since I was a teenager.
Okay.
And I tried prolotherapy, which helped some, but I've never been able to go up and down stairs, walk, exercise. I've always been not able to do any of those things. Very limited dancing. But with the stem cells now, my pain is, it's like a 90% improvement.
Excellent.
I can walk up and down the stairs, I can go for walks, I can exercise.
Are you dancing?
We haven't done that yet, but
Okay.
we're planning to do that. I started doing Pilates, and my legs actually felt good, which is totally amazing. I've
Excellent.
never had that. Never
So-
had that before.
Before the stem cell therapy, a lot of this stuff you wouldn't be able to do it, or else you'd have a lot of pain when you did
Right.
do it.
That's right.
Okay.
Yeah. Well, I'd have so much pain I couldn't do it.
Okay. So you were just at
Yeah.
the point where you weren't even able to do the things you wanted
Right.
to do.
That's right.
Anything else to add?
Well, I'd highly recommend it. I think it's well worth it.
Perfect. What was going on before you came into our clinic?
I was having a lot of lower back pain, pain in my legs, not being able to walk.
How long had it been going on for?
Quite a while, a couple of years for sure in the lower back.
How much had it affected your activities like walking? How much could you do or not do?
I could walk maybe a block and then I'd have to stop and then walk a little bit more and then stop again.
Okay. And did any other doctors say there's anything else that you could try or do?
Well, I'd seen an orthopedic surgeon, actually 3 of them, but the last one I saw said about the only thing they could do was go in and operate on it, clean it up or whatever. And That's when I ran into you guys.
Gotcha. So you had a stem cell injection in your lower back.
Yes.
How you been doing afterwards?
Much improved. I could tell within a couple weeks that it was starting to work because the pain started to subside.
Okay.
And I'm now able to walk at about 1.5 miles, which I wasn't able to do before. It's been several years before I've been able to do that.
Excellent. How was the procedure itself? Was it easy or was it complicated?
No, it was very simple. I didn't see it. I thought it was going to take longer than what it did. No, it was in and out.
Well, I had a lot of pain in my left hip, and I needed to pull myself up the stairs to climb steps. The first 10 steps would usually be somewhat okay, but after that I would have a lot of pain, and it caused me just to become really inactive.
Okay. Did it bother you outside of just using stairs, or was it just normally walking?
Yeah, normal walking too. You know, I'd want to go to the mailbox and get down the driveway, and before I take a few more steps, I was in so much pain that it was agony to get to the mailbox.
And how bad was that pain in your left hip on like 0 to 10, 10 being really bad?
Well, I could walk, but I would say maybe an 8.
Okay, so pretty severe.
Yeah.
Okay. So you went through our stem cell therapy program.
Mm-hmm.
What has changed in your hip since?
Oh, everything. I mean, I can jump, I can jog, I can go upstairs without holding on to anything. I can even carry things upstairs with extra weight, no pain. Just being able to walk and just, it's like I have my normal life back again. It's amazing.
Awesome. How much do you feel like you've improved 0 to 100%?
I would say 100% in everyday functioning. It's the only small issue that I have has to do with when I sleep at night, sleeping on my left side. It's tender after about 30 minutes. So, but
Besides
that's not a big deal. 100%, I would say.
And then recently you had a trip. How'd you do on that?
Yeah, about a couple of weeks ago. So this would have been 2 months after the
Injection?
treatment. Yeah. I had, my husband and I went to Cambodia. We went to Angkor Wat, and we were a little tentative about making these kind of plans because it is a lot of walking in rough terrain. And we went there, walked all day, starting like at 5 in the morning until the evening, and over rocks and up rugged little steps, and it was pretty challenging, but I survived the day without any pain. It was just amazing.
Excellent.
Yeah.
Okay, great. So tell us, what was going on that brought you into our clinic?
I had a severe pain in my right knee, and I could not walk hardly at all.
How long had it been going on for?
Maybe 4 months since I had the last cortisone shot.
Okay. And had your doctors looked at your knee? Had they said that you needed a knee replacement?
Dr. Anderson told me that it was bone on bone.
Okay.
And that I had to have a knee replacement.
Okay, but you didn't want to go through that.
I didn't want to go through that again.
Okay. So you went through, you had a regenerative medicine. You went through our regenerative medicine program.
Yes, over at Grizzly Cafe.
Yep. So then you came in, you went through, you had a regenerative medicine injection with the cell therapy. How much has your knee improved since going through that?
Well, I would say 2 or 3 days after I left here, I had no pain and I was walking with my cane.
Okay.
And then it just got better and better. I don't have pain. I just have a little stiffness.
Okay, so all the pain went away.
All the pain went away.
All right.
I appreciate you and I appreciate Dr. Hubert.
Absolutely.
Actually, somebody called me and asked me if I wanted to come to a seminar about the stem
Regenerative
cell.
medicine. Okay.
Absolutely, and I went and I decided I thought it was an issue for me
Okay.
that might be able to help me.
And what specifically did you have going on, if you don't mind sharing?
I believe it was arthritis in my big toe joint.
Okay, so a lot of pain in that toe then, I assume?
Yes, walking, every step that I took was very painful, and just I was willing to do anything.
Okay. Had like the foot doctor, had anybody else said there's anything you could do for it, or?
A podiatrist told me I had a bunion and also had arthritis in my toe. and to come back when I wanted surgery and never offered any other solution.
So you went through our regenerative medicine program. How much has your toe improved since?
I would say about 90%. So I'm pretty much back to no pain walking, back to where it should be,
Normal?
normal.
Okay. Was the procedure easy to go through?
Absolutely.
Well, we're glad you got better.
Me too.
So what was going on with your hip before you came into our office?
Well, in 2010, well, before that, probably 2008 or so, my legs gave me a lot of trouble. So in 2010, I finally went in and had a cortisone shot.
Okay, so you've had the hip pain for like 8 years roughly?
Oh, I've had hip pain for over 10 years.
Okay. And what couldn't you do because of the pain?
Well, I couldn't walk very fast. I limped a lot.
Okay.
So,
What else?
well, there was pain with it.
Okay.
And then I could go up and down the stairs, but every time I go, I usually go one step at a time because it hurt
Okay.
too much to go
Okay.
normal steps. And then that went on for a while, and then I went back to another doctor, and he gave me another cortisone shot.
Okay.
And then it was good for a short time, but then sort of acting up, and then I went to a therapist. And they gave me all these exercises, and I did them for a while, but it really didn't seem to help that much.
So
But it still was a long ways from normal.
how bad was it right before you came into our office?
Well, in April of 2018, it got so bad I couldn't hardly walk. So
Jeez.
I went to another for a while. And then I heard about stem cells, and I thought,
So you went through our regenerative medicine program. You had a stem cell injection into your hip, right?
on the 22nd of August,
So a little over a month
a
ago.
little over a month ago, and I had,
So what have you noticed change since going through that?
oh, a tremendous change.
How's the pain?
Pain is almost zero.
Okay.
And I can go up steps now one at a time.
Awesome.
And I always used to have to hang on to a handrail up and down steps. I don't
Yep.
do that anymore.
What about walking? How are you doing?
Oh, I'm walking much faster.
Excellent.
And I even started jogging.
Really, when's the last time you jogged?
Last time was today.
What was the last time before that?
Oh, probably 10, 11 years.
10, 11 years? Awesome. Anything else you want to say?
Well, I think it's probably about 95% now.
Better?
Better.
Awesome.
That's almost 95% of what it normally is, should be.
Excellent.
What would you recommend to someone who is listening to this presentation?
Oh, well, I'm sure it worked so good for me, I would recommend it to just about anybody that's having problems like this.
Excellent.
I was really in a lot of pain. I had problems walking, I had problems sitting, I had problems standing.
Where was the pain?
In my low back, in my knees primarily.
How long had it been going on for?
Well, probably for 30, 37 years.
Okay.
The back was, for sure.
And it was something that was bugging you like every day, once a week? How often did you have it?
No, it was constant, and it was really interfering. We like to travel.
Okay.
And because my husband is fit, you know, most of our trips involved a lot of walking, sometimes hiking,
Okay.
and it became very miserable to go on these trips simply because I couldn't do them.
Okay. So then you went through our regenerative medicine program.
Yes.
You had a stem cell injection in your lower back and your knee.
Yes.
How are those doing now?
They're a lot better. In fact, I have almost no pain in my lower back. I have no pain in my knees where the shots went in.
Okay.
I still have a little bit of pain on the outside of the one knee, but
Okay.
it's only when I make a certain movement.
And how long has it been since you had your injections?
I don't remember. October?
Like 90 days roughly?
90 days, yes.
You're still doing really well?
Yes.
Excellent.
Better.
Better.
It's
you
gotten
keep
better
getting
and better. Yes.
Okay. Anything else to add?
I would do it again.